Hello, everyone, and welcome back to the blog. With our numbers on the rise, we have to continue to be extra careful and vigilant and take the required precautions to reduce the spread of COVID-19. We know that this is hard on everyone, but we cannot let our guard down. We each have a role to play in protecting each other, patients, staff, physicians, volunteers, and visitors. So if you have new symptoms or if your usual symptoms get worse, please stay home, minimize contact with others, and complete the self-assessment tool to determine if you need COVID-19 testing. As we continue to monitor our COVID-19 response and the impact on the AHS healthcare workers, we know the transmission is continuing to occur within our workplaces. There's risk for transmission of COVID-19 in break rooms, charting areas, open workspaces, and other common areas if appropriate control measures are not followed. So joining me today to talk more about the prevention of workplace transmission of COVID-19 is Dr. Tsekrekos, Medical Director for Workplace Health and Safety. Thanks so much, Steve, for taking the time to be with me today. I understand that we have a new summary report on healthcare worker and COVID-19 infections. What are some of the highlights of the report?
The summary report covers a time period from September 1st to November 30th of last year and summarizes the COVID-19 testing data for AHS and APL employees and physicians. What the report showed from that time period is that we had 1,383 infections amongst our employees and physicians. And of the cases that have been classified with respect to where those infections were acquired, about 75% of those were acquired outside the workplace, and about 20% were deemed to have been acquired in the workplace. And of those infections that were occupationally acquired, 65% were related to patient exposures, 29% to coworker exposures, and about 6% to visitor exposures. One of the key takeaways of the report is that our current preventive practices are effective with respect to preventing infection of COVID-19 in our workplaces. So things like point of care risk assessment, use of personal protective equipment, hand hygiene, not coming to work with one ill, and so forth. When we see lapses in these preventive practices is where workplace infections are likely to occur.
Great, thanks very much for that, Steve. So just expanding on that, can you tell us a bit more about healthcare worker-to-worker interactions as a potential source of infection?
For sure. So our focus is patient care, but it's important to remember that patients are not the only sources of infection in our workplaces. And what this means is that we can't let our guard down, even when we're just interacting with our colleagues on breaks and things like that. So again, 29% of our occupationally acquired infections were related to exposure to an infected coworker. And of those infected coworkers, about 3/4 of the time, or 75% of the time, they were at work while symptomatic. So what this means is that, again, we can't let our guard down. So yes, we want to pay attention to preventive practices when we're dealing with, patient care type settings. But even when we're on breaks, we're on, handovers, things like that, or it's just our colleagues that we're working with, we still need to be thinking about, masking, distancing, hand hygiene, all these sorts of things in terms of preventive practices. We can't let our guard down in those situations. And as well, no one wants to be the index case on their unit and be the source of infection for, patients and coworkers and so forth. So it's important to self-monitor for symptoms during the workday, and don't be afraid to raise your hand, and don't feel like you have to soldier on and then suffer through it when you're feeling unwell. If you're feeling unwell during your workday, again, raise your hand and say, hey, I think I need to go home sick today. And as well, it's very important to continue to adhere to our daily Fit for Work screening. And if you're feeling unwell, don't come to work and stay home if you're ill.
That's a really important point, because for all of us, we don't quite understand if you're symptomatic, why would you come in? But we realize sometimes the symptoms evolve over the daytime or the nighttime, and we don't want to put undue burdens onto others. But at the same time, it's very important that you actually just put your hand up. It's okay to be sick and for the symptoms to evolve, and please do that so that you can go home and get well yourself. But what are some other critical things, Steve, that healthcare workers can do to limit workplace transmission?
Well, I think the key is that preventive practices work, but only if they're practiced. So precision of execution is the key when it comes to things like, point of care risk assessment, use of PPE, hand hygiene, all these sorts of things. You have to be consistent, and you have to be thoughtful in how you're doffing your PPE, all these sorts of things, and really give some thought to it. Basically, don't let your guard down. Don't be paranoid, but be practical. And in any interaction you have with someone else in the workplace, ask yourself, if this person was infected with COVID-19, could I potentially be putting myself at risk? So if, let's say, a coworker brings in some, baked goods from home, and we want to have a bit of a social gathering in the break room, and everyone's got their masks off and chatting away, having a good time, and not distance, these sorts of things. If that coworker was infected, potentially you're going to be putting yourself at risk. So, avoid those sorts of situations, and again, be cognizant and think about, COVID-19 is out there, and it's important not to let your guard down, especially when you're at work.
Thanks, Steve, for that. And better yet, maybe not bring in baked goods.
That's even a better idea, yeah.
At this point in time. But I mean, we understand that food and social gatherings really brings the team together, but right now during COVID-19 is just not the time to do it. Steve, what can leaders do to support this?
I mean, leaders always need to lead by example. I think probably one of the best things leaders can be doing is to foster a spirit of teamwork. I mean, I think at this point, everyone's pretty tired of COVID-19. It's easy to, take shortcuts, to make mistakes, to forget things. We're all human. But at the end of the day, teamwork is what's going to win the day in this sort of situation. And I'm reminded of the Royal Canadian Regiment slogan of "Never pass a fault." And what this means, for example, is if, let's say, you see someone doffing PPE incorrectly, talk to them about it. If you see people in a break room and the break room's crowded and people can't distance as a result, take action to try and address that. If you see a coworker who's feeling unwell, maybe ask them, "Hey, how are you feeling today?" And remind them that, if they're feeling sick, it's okay to go home. If you see a hand sanitizer dispenser that's empty on the wall, call attention to that so that corrective action can be taken. So don't berate or humiliate, but in a gentle manner, be supportive of your colleagues in doing the right things the right way consistently, and trust that in return, they're going to have your back as well.
And lastly, my last question for you, Steve, is how are we going to know when we've been successful?
I guess when we see very few, if any, infections in amongst our staff, for one. I'm sure the immunization is going to be a big help there, but always, even with immunization, we still need to be consistent with our preventer practices. And every summary report, and this one's no different, always highlights ways that we can improve on our preventer practices and where there might have been lapses and what we can learn from those. For example, in the present report, there is one case that's mentioned as an anecdote of a home care worker who did an appropriate point of care risk assessment in caring for their client, but also in the same room during that home visit were two household members who were symptomatic with COVID-19, which put that home care worker at risk. So thinking about things like point of care risk assessment, not being just focused on the patient in front of you, but also the setting and the environment that you're working in, and are there potential risks from others in that setting beyond just the patient. So these sorts of things in terms of expanding our thinking of how we look at preventive practices. But there's lots of recommendations in the report, and I encourage everyone to have a look and see what can be learned from it.
Thanks very much, Steve, for coming on today, and just encourage everyone to take a look at the report. It's actually a very good report, very informative read. It's easy to read. So thanks, Steve, to you and your team for compiling it. As I mentioned before, by following all of the safety measures in place, we can help keep everyone safe. It's easy to forget how far we've come. So let's continue to be extra cautious and make the safe and right decisions to protect ourselves and those around us. Remember, simple actions can make a difference. So as a reminder, practice safe work practices like adhering to all PPE measures, including continuous masking and eye protection, washing your hands regularly, physically distancing, and not coming to work when feeling unwell or showing symptoms, and completing your fit for work screening every day. All of these actions will help slow the spread of COVID-19. You can find the COVID-19 Daily Fit for Work screening on the ahs.ca/fit for work webpage. If you have questions, don't hesitate to reach out to your leader if you need help. Thank you again for all your continued support and dedication. We know this hasn't been easy, but together we'll get through this. And please get vaccinated when eligible, and encourage those around you to do the same. Thanks for watching, and I'll see you again next week.
Together, we do amazing things every day.